A very good morning. So today we'll be dealing with a new branch of Prosthodontics called removable partial dentures. So under this, we'll be learning about cast partial dentures basically. Here in this chapter, we'll be learning about what is the difference between a cast partial denture and an acrylic partial denture. What are the indications for a cast partial denture? What are the contraindications, or what are the situations where we cannot go for a cast partial denture? And then we will be learning basically the various types of removable partial dentures. Apart from this, we'll be learning the steps. What are the various steps used for the fabrication of a cast partial denture? And then we'll also be learning the components of a cast partial denture. So coming to the definition of a removable partial denture, it is defined as any prosthesis that replaces some teeth in a partially dentate arch. It can be removed from the mouth and replaced at will. There are basically two types of partial dentures. One is an acrylic partial denture, which you will be doing in your third year or final year. And these are basically transition dentures which are supposed to be used for a limited period of time, and after which has to be replaced by a more definite processes like a cast partial denture. Right? So let us learn what is an acrylic partial denture. An acrylic partial denture is basically made up of acrylic resin with clasps of wrought wire. They are commonly called as flippers. Tissue supported, they are basically tissue supported, and they cause gingival recession in a long-term use. That is why they cannot be used for a long term, and they should be replaced by more definite processes like cast partial denture. They are also called as gum strippers because they strip the gum. So basically, after a limited period of time or after the intended time, this has to be replaced by a cast partial denture. Now, coming to the cast partial denture. Cast partial denture is fabricated by the lost wax casting method, and it is basically made up of metal, teeth, and denture base, and acrylic resin. There are basically two types. One is a clasp retain with metal clasp for retention. The other one is attached retain partials, which is used for prefabricated attachments for retention. So the first picture is an example of a cast partial denture. Here you can see the cast partial denture resting on the teeth by the help of vests. The second one is also an example of a cast partial denture with precision attachments. The ends, the distal ends of the FPD, they have precision attachments, and onto which the cast partial denture will be attached. Now coming to the different types of a removable partial denture, there are basically three types of removable partial dentures. One is an interim denture, a transitional denture, and third one is the treatment denture. Now let us learn what is an interim denture. An interim denture is used to enhance aesthetics, stabilization, and function for a limited period of time, after which it will be replaced by a more definite prosthesis. Second one is a transitional denture, which again serves as an interim prosthesis to which artificial teeth which can be added as the natural teeth are lost and will be replaced by post-extraction tissue changes. Third one is treatment denture. It is used for treating or conditioning the soft tissues that have been abused by ill-fitting prostheses. They are used after surgery to protect the surgical site or to reposition the soft tissues. Tooth-supported RPD is a dental process that depends entirely on the natural teeth for support. Here, the support is basically by the teeth and not the tissues. Here, distal extension based RPD is a combination of both tissue and teeth supported. So any removed dental processes that are supported and retained by natural teeth on one end and the denture base segment on the other, to which a functional load is carried by the residual ridge. Now coming to the abutment, any tooth or portion of the tooth that serves to support or retain the prosthesis is termed as an abutment. A fixed partial denture is cemented over the abutments, whereas in RPD, it is attached to the abutment by a clasp assembly. Retainer. It is the fixation device or any form of the attachment that is applied directly to an abutment tooth and is used for fixation of the prosthesis. Now, coming to cross-arch stabilization, it is the resistance against dislodging or rotational forces by using an RPD design that uses natural teeth on the opposite side of the dental arch from the dental space to assist in stabilization. Now, coming to the indications and contraindications. Indications: one is age. Below the age of 17 years, it is not ideal to go for a fixed partial denture. So in such situations, it is more advisable to go for a cast partial denture. The reason because in young patients below the age of 17, the pulp columns are enlarged. So while doing a preparation, there is every chance of exposing the pulp. So in such cases, it is always better to go for a cast partial denture. And old patients with frequent health problems, again, cast partial denture is the treatment of choice. Length of the denture span. If the denture span is long and where an FPD is contraindicated because it cannot support the teeth, in such cases, it is better to go for a cast partial denture. Then the abutment tooth. If the abutment tooth is weak or it has, or if the prognosis is not that great, and it can be, then it's better to go for a cast partial denture. If the periodontal support of the remaining teeth is weak, we can give a cast partial denture and enhance the support by splinting effect. Cross arch stabilization. Cross arch stabilization is another important feature by which is another indication for cast partial denture. Excessive bone loss where you can't go for implants on FPD. Again, cast partial denture treatment of choice. Aesthetics, especially in the frontal region where there is loss of labial bone. Aesthetics, cast partial denture can provide lip support and thereby enhancing aesthetics. Immediate replacement of teeth following extraction. And ninth one is emotional problem patients. And the last one is patient desires. What are the contraindications? The contraindications are the patients who lack dexterity to inherit the prosthesis, patients who do not care to maintain good oral hygiene, and then epileptic patients. Steps in fabrication of a cast partial denture. The initial step is examination of the clinical situation. It's called diagnosis and treatment planning, where you diagnose the situation, you check for the quality and the quantity of the abutment teeth and the residual ridge. Based on that, you come to the treatment plan, that is to give a cast partial denture. So first you take diagnostic impressions, you make your diagnostic cast. After that, you do surveying. This is followed by mouth preparation. Once the mouth preparation is done, you do a secondary impression, then you get a secondary cast. Once you get a secondary cast, is then the survey of the design is then transferred to this cast, and then relief is done. This is followed by duplication. Next step is, once it's duplicated, you get your refractory cast. Now on this, you will transfer your design and you will make your wax pattern of the framework. This is then casted. Once the casting is done, we then place it in the patient's mouth, try in the framework, check for any misfit, and then it is corrected. Once this is done, the occlusion rims are then attached to the framework and jaw relation is done. This is followed by trial. Then after that, you transfer it to the articulate and do your teeth setting. Then you try. Once that is done, this is then transferred to the patient and the proper try is done. And if you're satisfied to the time, then you go for acculization. Once it's acculized, you do the denture insertion. Once the denture insertion is done, then you go for your maintenance and recall. That is once of 24 hours, after 1 week, and then after a month. Now coming to the components of a cast partial denture, there are basically three components. One is the connector, the retainer, and the denture base. Connectors again two types. One is the major connector and the minor connector. Retainers are again made of two types. One is direct and indirect. Now, under the direct retainers, we have rest, retentive arm, and reciprocal arm. So with this, I complete the introduction to cast partial dentures. I have described the indications, the contraindications, steps in the fabrication of a cast partial denture, and last of all, the components of a cast partial denture. So with this, I conclude my class. Thank you. Thank you all for listening.